Good afternoon, Dr. Sujit. It's a pleasure having you here for the Fireside Chat. And I'm sure I, as well as all the audience here, would love to hear a little more about your journey. It has been a stellar journey, as we saw in the AV. So could you just share from your extensive experience, how have you seen the pharma retail evolve in India?
Well, for India, pharma retail have been more of the branded perspective of medicines that we have seen in India. But as days, months, and years are proceeding ahead, we are finding a conversion from branded to generic pharma retail, and that's what would unfold in years ahead for India.
It's interesting when you talk about generic medicines. Now, as I understand, generic medicines obviously makes more sense for the wide population at the bottom of the pyramid. Now, other than the price aspect, what do you think will make more and more people adapt to generic medicines?
If you see, if you see that the way how India is unfolding, Indians or people at large, they really cannot afford expensive branded medicines, especially for patients with diabetic, cardio kind of ailments, or gastro, nephro, or geriatric patients. They really cannot afford that 6,000-7,000 rupees of consistent payout of medicines. There is where high quality generic medicines comes, and they can actually get the similar molecules of a very, very high quality in the similar price. And the qualities are as equivalent as similar. So that is what India is unfolding. And that is what at large should happen for India, so that India not only stays more and more healthy, but also they can save a lot of money.
So just to give a perspective, I think generic medicines, at least I'll talk for myself, it's not very widely understood. So just to give a perspective, if I were to say a cardiac patient, you mentioned about cardiology, yes, it's expensive. Now, a cardiac patient, if you were to give a comparison, if I'm a cardiac patient in a month, what would be my expense as against, say, if I were to adopt to generic?
Sure. So if someone is a cardiac patient and they have to take perennial monthly medicines every month, easily the branded medicine cost would be anything between 6,500 to 7,000 rupees. If it's the generic medicines of a high quality, it would be close to around 1,500 rupees. So a comparison from 7,000 rupees to 1,500 is what the savings of 4,000-5,000 rupees easily be there.
So that's a huge saving.
That's a huge money.
Because
huge money,
cardiac
yes.
medicines, as I understand, they are lifelong. So if a person lives for 50 years, 60 years, then that's literally lakhs of rupees saved.
Absolutely, yes.
Yeah? Very interesting. Now, let's come to Davaindia. Now, in the speaker's lounge, you mentioned something very interesting, and I was fascinated by that. You mentioned about Davaindia being primarily private label. Apart from the generic medicines, you have also wellness categories. So can you just share something about that? What is the reason behind this, primarily private label initiative?
Davaindia is the only retail pharmacy chain in India which operates almost at 98-99% private label. And operating at a such larger SKU with so many therapeutic segments, right from cardio, gastro, peds, gynae, obs gynae, so on and so forth, along with wellness, nutra, OTC, to operate at a 98-99% private label is a huge outcome. The perspective is that we are very, very clear that the end consumers of India cannot and should not be charged high price. And that's what Davaindia is all about, to enforce and reinforce very high quality, be it in wellness, nutra, OTC, and definitely the medicines, but at a very, very affordable price.
That's a really noble objective, and I'm all for more and more of Davaindias, and as long as it benefits the common man. Now let's flip the topic, and you have got a tremendous experience across different kind of organizations. You worked with national retailers, international retailers, family-run businesses, corporate professional. Now let me split this question into two parts. First, can you tell us what's the biggest difference you've seen from a traditional family-run business vis-a-vis a corporate, so-called professionally run business? And what would you say are the merits of both that we can combine to build a great culture?
Well, culture have always been a forefront for me to drive any organization, always. For a family-driven business, India is primarily a country, where you have lots and lots of family-driven business, even large organizations which are there. So for a family-driven business, you have to work primarily with the promoters, and you have to work on changing the thought process of promoters toward driving it to corporate. Now it's easier said than done. But for large organizations, when we work, it's more of the process is already set and you don't need to work. Everything is based on set process. But the advantage and disadvantages are always there. But when you really work to transcend a family-driven business into a corporation, it needs lots and lots of hard work to ensure that you are driving it to build a large corporate company, and you actually build the entire equation in such a way that you drive and build it in a way that you can actually build the scalability towards the sustenance of at least some 5-6 generations for that organization, because it's no fun making a company of only 1 or 2 generations. So there is where we come into action, where we work very closely out with the families, the promoters, and work towards building the value, working the entire journey of the brand, the company at large, and build an organization that would not only be sustainable, but that would also be scalable in generations ahead.
That's quite interesting. Now let me kind of take this further. It's a very topic which is close to my heart, organizational culture. So how would you say a culture is built? I mean, is it built over years, decades, generations? And what are the 3 things that go behind a leader's building a great culture at work?
So to build a culture, it is always and always top-down. It's always top-down. So the way the leader actually thinks, visualizes, and drives it back. So when you build a culture, you have to be very clear that how you want to build the fundamentals of the organization, what are the basic ethos, practices that the organization would actually get into to build the right kind of DNA for that organization. Because you have to keep in mind that we are working to build such a DNA that would sustain for generations ahead. So that's what culture is about. And when you build a culture, I think a very strong parameter, the top 3 that should stand, is to ensure that we drive based on the right kind of value systems. We drive based on the right kind of ethics and ethos, and there should be utmost honesty when you drive such kind of culture-driven organization.
As a leader, so I think it would be interesting to know from you, what are some of the initiatives that you've kind of taken to ensure that there is a culture which is built as per what you mentioned just now?
So I can tell you multiple such initiatives that we have taken for Davaindia, Zota Healthcare, but to keep it as crisp as possible. For example, most of the retail companies that you see, that they would work on increasing the ticket size. We operate to ensure that we give the right kind of quantity to the end patient. Right. So when other retail companies are working to see that how they can sell more, we try to ensure that at the last mile store level, how we can sell right. Now that needs a lot of guts to do, because you are at times compromising your top line. But the perspective that we try to build in is that don't sell more to the customer, that the customer goes back home and feel, why have I purchased that? Most retail companies do that. We don't do that. When you see back internally in the company, we operate on multiple levels to ensure that everyone is genuinely empowered, right from the security to the topmost level. Now, saying, believing, and doing are all different things, but that's what we do. And when we do that, we ensure that the internal organizational movement actually translates and percolates to the end store, and the entire value system actually flows around. Now, it's a lot of dynamics that actually goes through in the whole thing. Now, when you do such kind of things, then you not only build a robust culture, but you build a wave that would be sustainable for the organization.
So what you mentioned, I mean, being in retail for decades, I can say is very contrarian philosophy, right? So we've always believed in saying that upsell, cross-sell, build your ticket sizes, get your impulse purchase, get the customer to walk the store. And, so it's a very contrarian thought process. So what would you say are the challenges you have faced at the front level, at the ground
So
level?
yeah, that's exactly what I said. It's very, very contradictory, but that's what also builds a larger top line. Because when the end consumer understands that you genuinely care for the customer, that customer will bring back 10 customers back to you. Because you're not trying to oversell. Because as long as you are genuine, as long as you know that you are not trying to push extra goods to the end consumer also understands, maybe if not then, going forward, that he feels, they are honest stores. Now, at short-term level, you may not drive enough revenue, but at long-term level, you drive a good amount of top line on that. Now, there is the fallacy, where if you push your people to look for short-term top line, then that does not happen. Now, there is where, as a leader, we need to be patient to understand that we are not building this business for 1 or 2 years. We are building this business for years ahead. Now, that's where leadership comes into action. And the moment all leaders understand this, then they would actually build a sustainable consumer base for them that would be long-term.
So when you talk about sustainability, today sustainability is all the buzzword. So a lot of brands talk about sustainability and green and eco, and then this term called greenwashing also. What has your organization done towards building true sustainability?
We have done multiple things. So what is sustainability for India? Sustainability for India is that when you can get high quality medicines at affordable price. Very simple. Sustainability is not when you are selling expensive fashion apparels. No. Sustainability is not when you are selling expensive real estate. No. Sustainability is not when you are selling sweet donuts. That's not sustainability. Sustainability for India is that when 80-85% people cannot afford even the basic 10,000 rupees or 15,000 rupees to get back in their home, education and healthcare is the actual sustainability for India. So when we talk about sustainability, I can give again multiple examples of wellness, Nutra, and OTC, but let me come to medicines. A simple methylcobalamin, like B12 deficit short, needs some 350 rupees if you go to a hospital. You come to any of our Davaindia stores, it's only 12 rupees.
Wow.
So just, you don't even need to take a shot, just take the strip on the mouth and you get a 1500 mcg vitamin B12. And people who are vegetarians, at times they get deficiency of vitamin B12. So I can give on and on such kind of examples. That's called sustainability. Sustainability is not when you build flashy brands around and try to sell those products and youngsters become more diabetic. That's not sustainability.
So as an organization, you've talked about the culture, you've talked about how you're looking at the portfolio expansion. Now let me ask you about a topic again which is very close to my heart, about women empowerment. So what would your views, personal views, be on women empowerment, and how has that translated into your work culture?
So women are a strong forefront for us as an organization. And both internally and externally, we believe and we enact very strongly through demonstrative activities women empowerment. So what do? We ensure that at our corporate office level, we have enough women who are empowered for their respective business. The highest level of our office, which is Group CEO's office team, they have almost, I would say, 75% women leading it. Our pharmacists at stores, we had 3% women. It moved up to 18% women now. So that's a huge scale up in terms of women. We drive programs like #change in the country to prevent domestic violences. We work lots with Gram Panchayats and the local communities and villages towards working on women menstruation cycle education systems. So there's lots that we actually do for women empowerment, both internally in the organization and externally for country at large.
So you talked about menstruation. Now that's a pretty taboo topic in our country. Yeah. So despite movies like Toilet Ek Prem Katha trying to kind of make a light-hearted but important message out of it. Now, what is the biggest challenge that you have faced while trying to work on this space?
So both for menstruation and much more taboo is domestic violence, where domestic violence does not come out. So that's what I said, we work with the local governing bodies, the Gram Panchayats and similar, where, so for menstruation, we run camps and educate the women as to why pads are hygiene for them, why cloth is not hygiene for them, what happens when things does not works out, and they get into UTI, urinary tract infections, so on and so forth. What will they do when they have UTI? Of course, we do distribute a lot of sanitary pads of Davaindia, but it's very much a taboo. But as we do, and as we are the largest private retail generic chain in the country for pharmacy, we take the first mover advantage to educate the women of India, especially in the villages, to understand the importance of a good, healthy menstrual cycle. And it's a lot of work that we do. The road shows, the working with the local levels. So a lot of work actually goes into it.
What's the challenge that you face? The
The
number one
challenge is that women are too shy to come up to us and talk about it, and that's typically how Indian women in the villages are there. And at times, when they go back home, at least for menstruation, still we don't face so much challenge as what we face for domestic violence. Because when women speak to us for domestic violence, when they go back home, they face much more domestic violence. And there is, where we work very, very closely with their families also to ensure that, we address those things.
So now, when we talk of pharma retail, now you've been through the journey, across different companies. What would you say is the trend which is happening? Where do you see the future going? And what are the inhibitors to growth?
I think the trend that we see is towards getting a very much strong push in the generic space of India, and a strong inhibitor is to get the right kind of people.
Okay, and as a parting, thought, what are your plans for Davaindia and generic medicine as whole? I mean, you can share with everyone.
So Davaindia is poised to grow the way it is growing. As I speak, every 12 hours we are adding one store in the country. That's a very deep number across the country. That's what we are doing. But the largest story that would unfold for Davaindia is that we are poised to build the best organization in India culturally, and that's what we are working towards it.
Thank you so much, Dr. Sujit. It has been a pleasure talking to you, and I'm sure I have been enlightened, and I'm sure the audience also found this pretty enlightening. Thank you so much.